The initial assessment of a patient is conducted to quickly identify any life-threatening conditions. Although some of these conditions may not be readily apparent, they will be reflected by changes in respiratory, circulatory, and central nervous systems. By obtaining a patient's vital signs, you often can detect a developing life-threatening situation and provide treatment to prevent serious complications. Use appropriate body substance isolation precautions prior to beginning patient care. Using the first two fingers, palpate and count the rate of the radial pulse at the wrist. Describe the quality of the pulse, whether it's strong, weak, thready, and the regularity of the rhythm. Interpret the findings. Count the rate of the patient's respirations and describe the quality. Is it shallow or labored? Assess the regularity of the respiratory pattern. Interpret the findings. To palpate systolic blood pressure, apply the blood pressure cuff snugly to the upper arm. Be aware that choosing the proper blood pressure cuff for the patient is an important part of obtaining accurate blood pressure. Most cuffs have markings to identify the correct size. When the cuff is placed around the patient's arm, the arrow or other markings should fit between the minimum and maximum size indicators. Locate the radial pulse using two fingers. Keep the fingers in place throughout this procedure. Gently inflate the cuff, feeling for the disappearance of the palpable pulse. After the pulse disappears, give the bulb one or two more squeezes. Carefully and slowly release the air from the blood pressure cuff. Palpate for the return of the pulse. This is the palpated systolic pressure. Deflate the cuff completely when finished and prior to reinflation if subsequent attempts are performed. To auscultate blood pressure, apply the cuff snugly to the upper arm. Place the diaphragm of the stethoscope over the brachial artery. Inflate the cuff gently, listening for the carotid cuff sound to appear as the pressure increases. After the sounds disappear, give the bulb one or two more squeezes. Carefully and slowly release the air from the blood pressure cuff. Listen for the return and disappearance of the carotid cuff sounds. The return of the carotid cuff sounds gives the systolic blood pressure, while the disappearance gives the diastolic. Deflate the cuff completely when finished and prior to reinflation if additional attempts are performed. Interpret the findings.